Greetings, all. My name is Cameron Butler. Our consultation agency, Butler Business Innovations, has been working with the organization for the last few months and has identified some various people-related business challenges. I have prepared a formal analytic research proposal presentation to address a critical business challenge faced by this organization related to patient care quality. I appreciate this opportunity. So let's jump right in. Here is the business challenge we discovered. The quality of patient care has declined in the cardiac ICU. There are many potential variables as to why this is occurring, but prior to exploring some of them, let's explore the problem and context further. Over the last 3 months, the cardiac ICU has continued to experience a decline in the quality of patient care. Given the acute effects of the pandemic, the increased patient workload was believed to have subsequently caused a reduction in patient care. However, the COVID volume has been low, about 10 or less patients for the last 3 months. The staffing ratios are back to normal, if not better, given that some travelers have not yet reached the end of their contract. Yet, morale is still low. The nurse manager has provided insight into the standard workday of the nursing staff and the culture of the unit. Her team provides care for some of the sickest patients in the hospital with cardiac complications, recovers patients after they have undergone cardiac surgery, and maintains preparedness to manage the care of surgical overflow patients. The current trend in the quality of care is critical to address as it affects patient mortality, patient satisfaction, and organization compensation. The 5 W's of the business challenge are the who, patients, what, the declining care quality, when, occurs currently or during the patient's stay, where, in the cardiac intensive care unit, why. This affects patients' mortality, patient satisfaction, and the organization compensation. The following analytics team members are needed from across the educational institution, as they have valuable knowledge, expertise, and insights to help solve this business problem. The Chief Nursing Officer provides oversight for all adult nursing related challenges and activities. She is the final decision maker. The Unit Director is the administrator who oversees the cardiac ICU, step down, telemetry, and floor units. She is an advocate for both the organization and her teams. The Unit Manager oversees the day-to-day business needs of the ICU, develops, and maintains frontline staff. She will be able to provide the most insight into the unit's culture and the typical challenges they face. The Director of Talent Acquisition and Clinical Experience is an analytics specialist who can provide information and data on quality, hiring practices, and clinical specific metrics. The business partner works with the manager to translate clinical information into business terms for working with the administrators. The SVP, or Senior Vice President, Strategic Support and Planning, is in charge of financial appropriation or sets budgets, has access to historical and current data, and can help monitor a metric's degree of change. I have formed 5 hypotheses to potentially determine why our ICU is experiencing a decline in patient care. Patient care quality is our dependent variable in each hypothesis. The criterion variable tests patient satisfaction scores, The data will be retrieved from our NRC Health Quality Reporting System. We can compile the raw data to represent the average monthly patient satisfaction scores over the last 3 years, from 2019 to 2021, to produce ratio data. Our first hypothesis is, if core staff is better compensated, then patient care quality will improve. The manager believes that this downtrend of care quality is related to the financial inequity presented by the contracting of traveler staff. Traveler nurses are paid significantly higher than the core staff to produce the same work, thus promoting the dissatisfaction of the core staff. The variables tested in this hypothesis are independent variable of compensation and the constant dependent variable patient satisfaction. Compensation data will be pulled from existing data collection completed by payroll to compare the average core staff compensation and the average monthly patient satisfaction scores from the last 3 years, 2019 to 2021. Since both variables are expected to produce ratio data, we will perform the inferential statistical test of correlation. The second hypothesis states, if the unit patient acuity average is decreased, then patient care quality will improve. It is believed that when the average unit acuity is elevated, the increased workload causes a decrease in patient satisfaction due to increased wait times and decreased care. It would be logical to define this as the main contributing factor. However, the increased workload is mitigated by the additional travelers acting as resource nurses. The predictor variable tested here is acuity level. Our existing data source is the unit staffing report, which will function in comparing the average monthly acuity level against the average monthly patient satisfaction scores over the last 3 years, 2019 to 2021. The predictor variable of acuity level will provide ordinal data paired with the criterion ratio data to produce a rank-ordered correlation statistical test. This statistical test will measure the degree of relationship that may or may not exist between the variables. Next, we think of the average years of nursing experience on a unit are increased. Then the patient care quality will improve. As clinical practitioners, nurses learn best through experience. Senior nurses with many years of experience are expected to outperform their less experienced peers, implying that more years of experience equals better quality care. The tested variable of average career age is our predictor variable. This is not information we have tracked in the past, but our workforce management system, Workday, could provide this new data collection. The function of the data collection is to explain the relationship between average career age per month with monthly average patient satisfaction scores. The ratio data will be collected to create a statistical correlation test. Fourth, we speculate if staff is provided incentive through rewards, then patient care quality will improve. To create incentives through rewards, leaders must ensure the rewards given provide motivation and are of value to the recipient. In addition, leaders must simply remember to give rewards. The rationale for this hypothesis is that rewards improve staff morale, which may improve patient care. We will measure the predictor variable of unit reward disbursement percentage related to overall headcount. This data can be assessed through the reward program reports. The function of our data collection will be to explain the relationship of the ratio data to produce a correlation test. Finally, we hypothesize if staff morale is improved, then patient care quality will improve. As alluded to in the previous hypothesis, we believe morale has a direct influence on patient care. The predictor variable here is morale. The HR team has existing tools which cumulate engagement survey data for the organization's various departments. The function of gathering this data is to explain the relationship between employee satisfaction and monthly average patient satisfaction scores. Since the predictor variable offers ordinal data, we will perform an ANOVA test to determine if there is a significant relationship between the two variables. Hopefully, information gathered during this research will provide the organization with a practical solution to their people problem. This concludes my presentation. I will now allow for time for any questions. Thank you again for this opportunity.